be here not only representing the University of California, San Francisco, but to tell you about a new program that is just being started called ENLS. And I am currently the Vice President of the Neurocritical Care Society, and we're actually very honored that Dr. Castillo-Abrego has formed a formal affiliation with the Panama Critical Care Society and the Neurocritical Care Society. She is on our annual meeting committee and has been a valued member of the Neurocritical Care Society. And ENLS is called Emergency Neurological Life Support. And I say it's about time. And that means two things. One, it's about time we had a program where we could educate all of us on standard emergency neurological care. And I'll tell you more about why that is. But also, ENLS is about the time in the care of the patient. It focuses on the first hour, the so-called golden hour of when we can make an initial difference in resuscitating our patients and getting them in that early urgent care. There are a lot of programs, and many of you have already probably trained in these programs, certifying education for emergency care. BLS is standard CPR, and certainly, at least in the United States, it's recommended for anyone in the population to learn this. ACLS, Advanced Cardiac Life Support, is something that's supported by the American Heart Association, but in most hospitals in the United States, it's actually a required education and certification for emergency medicine nurses, for emergency medicine physicians, or doctors in the intensive care unit, and nurses in the intensive care unit. PALS and ATLS likewise. And many of these programs have been around for 40 years. And it's actually quite remarkable, as we've thought of this, that there is no similar program for neurological education. There are a lot of lectures and textbooks, but there's no standard, straightforward program where someone who is a new trainee or a nurse or a physician to come in and say, I want to learn the basic aspects of this care. I want to have a certification that shows that I have done this, and then that will help me have a baseline understanding so that we can all be working together and start at the same level. So because there was no standardized course for this, the Neurocritical Care Society thought this would be a good idea. And the idea of a program like this is not new, but this is the first program that's been able to come together and organize this and now make it available not only in the United States but internationally. And this was conceived in 2009. Two junior members of the Society, of Neurocritical Care Society, Greg Capinos and Edgar Sarmiento, put forth an idea that we ought to come forward and organize this. And so the Neurocritical Care Society took this and created the ENLS working group to do several things. Create a set of practical protocols to be used by first-line physicians and nurses for common neurological emergencies. So these aren't talking about all aspects of ICU care. It's just a practical approach to the first hour. We wanted this to be evidence-based as much as possible, but we know that there is a limit of studies that tell us what to do, but we still have to make decisions. So if there's high-quality evidence lacking, we still had a pathway and a protocol. And then the other thing that was very important is how to communicate. When I am, as an intensive care unit physician, receiving a patient from the emergency room, what I want to hear. What I want to hear the emergency physician say, I have this patient with an intracerebral hemorrhage, and the hematoma is 30 cc's, and their GCS is 6. I don't need to hear about their family history and where they grew up and a lot of other things. I need to hear about a very focused amount of things. And the idea is to make it very similar, analogous to these other well understood and used programs. So we set out and made 13 topics, and some of them are disease-based, like intracerebral hemorrhage or spinal cord injury, but some of them are symptom-focused, acute weakness, airway, in order to balance the aspects that we have to do in the care of these patients. And we decided that this is really not a neuro-ICU program. It's not an emergency medicine program. It's a combination of the both. And so each protocol and module was written by both an emergency medicine physician and a neurointensivist together. And Scott Weingart is the emergency medicine director of ENLS. He's at Mount Sinai in New York. And Wade Smith is the neurointensivist director of ENLS. He's at UC, University of California, San Francisco. But each module has a separate co-authors. And this is one of the web pages, because the other thing we wanted to do, actually I'm going to go back to the prior slide, we wanted to make this a program that could be taught in person, but the primary way people would learn about ENLS would be over the internet, so that anybody, anywhere in the world with internet access could have access to this, could get to it, could take the course, could take the multiple choice questions at the end of each module, and get certified. So for our first approach for this, we have not created a simulation program where you have to do it in person. ACLS has that, and we may get to that point someday, but we wanted to start with a way that we could disseminate it to everyone. And this is a page where you can go on the web for ENLS. And you see on this side, there are a number of the topics: acute non-traumatic weakness, acute stroke, down to coma, meningitis, status epilepticus, a lot of different things, focusing on the 1 hour. Now, one thing we wanted to do, like ACLS, you have to pay to get certified in ACLS. You have to pay to get the educational information, and you have to pay to actually get the continuing medical education credits. And that's fine, but we wanted to do something that was a balance between the two. So to get officially certified in ENLS, there is a charge, but the protocols themselves, what to do, we wanted to make them publicly available for everyone. And so this is we call it a public domain website where you can go and you can click on the protocol. So if we clicked on the protocol here for a spinal cord injury, spinal cord compression, this is what you see. And it's meant to be very straightforward and simple. So over here on this side, there's a green box that describes spinal cord compression. It just has acute signs and symptoms. Basic things to do. And you'll see if you go to this website, hopefully when you go to this website, that this is an active website. So you click on that box, let's say that says spinal cord compression up there, and those 3 boxes show up. And it focuses you on quadriplegia, or imaging not available, or imaging is available. And you click on one of those boxes, like let's say you click on that special airways issue box, click on quadriplegia, it opens up a box about airway. So it's active and it brings in the information. But on the far side, you see there's a checklist. What are the things you need to know? And if it's not on the checklist, maybe it's not necessary for that first golden hour. And then communicating to consultants. A template of how nurses might sign out, of how emergency physicians and intensivists can communicate. The other thing that's very important about this is we all realize that this is a new approach and that we don't know the answers for many of these questions. So we have a section here for feedback. And if you're doing this and you look at this and say, I think that's wrong, I think that's not proper the way to do it, You click on that and you send feedback to the ENLS group. And when we developed the protocols first, we actually sent them around in beta versions to all of the Neurocritical Care Society members, and they had the opportunity to say, I think this ought to be different, and so forth. Because we think that these protocols and this education will grow and improve with common group feedback. So if you go to this, when you go to this and you think we're wrong, tell us, and you be part of the solution. So here's how it works. And today, we're not going to talk about the ENLS specifics. We're going to talk about sort of how the program works. All topics have a flowchart protocol, a peer-reviewed manuscript, a video lecture presentation, a slide set, then multiple choice questions. Some of them also have a frequently asked questions section and even a podcast. And the way we've rolled this out, we had a session at the 2012 Neurocritical Care Society meeting in Denver last October where there was an ENLS lecture given. And one of the authors of each section gave a lecture, and that lecture was videotaped. And the slide sets for that were done in a standardized way, and they were kept. And those are now put online and used as the basis for ENLS education. We made changes to the material and some of the questions, the multiple choice questions for certification, based on feedback. This is meant to be an active, continuous process. And as of last month, we've now opened the site on the internet so that anyone in the world can go and get certified in ENLS. Okay. As of right now, it's English language only. Okay. And that is one of the things we've had to do in terms of initial rollout. So let's go to the site. I'll show you what it looks like. You can access this site by going directly to this web page, or you can just go to the Neurocritical Care Society website and follow the links. And so this is what it would look like. You would be at ENLS, and down here, let's see if I can, there's a little section that says ENLS protocols. And you click on that, and you come up with a list of the protocols. And so let's say we clicked on the subarachnoid hemorrhage protocol. You'll see it lists all of the different things, and each one of these is a link you can go to. It has the learning objectives, the protocol, the manuscript, the video, the slides, and then ultimately the test. Don't take the test first, okay? That's not the point. So in the journal Neurocritical Care, there was a manuscript that was already published for each of these sections. And this is something that you can download through the ENLS website, or if you have a subscription to Neurocritical Care or your hospital or university does, you can just get this. And so it was in this issue of the journal last year. So let me show you an example using subarachnoid hemorrhage of how this works. This is the protocol. It's not very fancy. It's meant to be straightforward so everyone can learn it. I want my nurses in the emergency department to be certified in ENLS so that they can understand the disease that they're treating. I also want my neurointensivists to be certified, even though there may be a difference in the advanced care people provide. And so it starts with one block, then clinical features, airway, pre-hospital. If it's gray, that means it may link to another protocol, like this links to the entire airway protocol. Each step in the protocol is explained. There's a bulleted format that describes what aneurysmal subarachnoid hit is in terms of a classic presentation and a not classic presentation. And it goes through this in a fairly straightforward and condensed format. This is Owen Samuels. Dr. Samuels is head of neurocritical care at Emory University, and he was the neurointensivist author of the subarachnoid hemorrhage module. And he gave the talk at the NCS meeting, and this is just a screenshot. You can go and you click on that, and you can watch his talk, accompanied by the slides. And then After you've done all of that, if you choose, you can go take the test. And there are 10 questions. You have to get a certain number right. I forget how many, but it's you don't have to get all of them right, but hopefully you'll get most of them right. There's about 500 questions that were written, and our nursing section of the Neurocritical Care Society actually organized the writing of this and did a tremendous amount of work. It's not 500 questions that you take; it's 10 for each module. But with that many questions, you can mix it up. So if Dr. Lee takes the test, he can't give me the answers because I may get a different set of questions. And if you do all 13 modules, you can be certified in ENLS. And so this is my certification. And I also got a little pin that says ENLS that I wear on my white jacket when I go around on rounds in the intensive care unit. So people look at it and say, "What's that? What's that?" I said, "Well, let me tell you." But part of it, that's what we're doing here. We all are trying to promote education in the field. This is our initial pricing structure, and it's based on individual physicians going to the website as of now. That's our first rollout, or individual nurses. And it's graded in terms of cost based on grouping and the International Rate Guide for the World Bank. You can get CME credits, certainly in the United States. So this is a start. And we hope this is going to be core education for neurology, neurosurgery, emergency medicine, and critical care. The golden hour. But the target group is not just doctors. We think it's anyone involved in the care of patients with these diseases can benefit from learning this, whether it's learning specifics about the disease or learning about how to communicate as we hand off patient care. We consider this a living document. We don't think this first version is going to be the last version. It's going to change based on new data, but on feedback. However, rather than trying to make everything perfect, we said, let's start, let's get it out there. And we consider this a platform for identifying issues for future research into the golden hour of neurological emergencies. The feedback that we all give saying, this is not right, that's probably a research project. So the protocols are online. You can go here for free, download the protocols, start using them now. That's great. That's what we want. The training site is open last month, and you can go and do the full course now in English language, as we said, and get formally certified. Our initial target groups are trainees in neuroscience, like neurology and neurosurgery, and emergency medicine house staff, as well as intensive care unit doctors who care for these patients. We also focus on nurses that are involved in this care, and then any physician that just wants to learn about it. And we have really looked at multidisciplinary support because this is important for our colleagues who are involved in this all the way from the emergency department through the intensive care unit, regardless of your specialty. And we also hope that this may be of value to our international collaborators. The next step is to figure out how people can learn to be trainers in ENLS. And at the Neurocritical Care Society meeting this October, we're having our first ENLS Train the Trainer course. So it's a half-day course where folks can come together and learn how to train or teach ENLS. So that maybe at next year's meeting here or at another meeting, we might have a full-day course of just ENLS, and folks can provide that if that's of interest. We also need to figure out how we might consider groups of residents or groups of nurses or international affiliate societies like you have here with us on how to coordinate that as group pricing. And then there's a lot of talk about doing an in-person simulation. And that may be something we consider. But for now, we want to get the education out there and provide the opportunity. And then as we said, potentially doing international lecture-based courses here or in the U.S. So I want to thank you very much for your attention, and I'm happy to take any questions now, or I'll be at the meeting for a couple more days. Thank you.